Okay, hello all. This is my second book review, and the book is none other. The book is written by none other than the Dr. Gaurang Gaikwad sir, who the man who needs no introduction. Actually, he has written more than 10 books up till now. He is also running his courses in India and abroad also, and he sits as a practice consultant doctor with Dr. Sankaran sir, and also runs his own clinic in Mahim Dadar, Mumbai. So this is the book, friends. I can assure you that after reading this book once or twice, it is definitely going to change your life. So please stay tuned with this video, and you are also going to get offer to buy this book in this book and his offer also on his upcoming course, which is going to launch by June 2024. So please stay tuned and watch the video at the full length, so that you can get the offer code to get discounts. So firstly, the uh, back cover of the book depicts about the author's journey, how he had become a homeopath and with whom he worked, and also for which books he uh, helped, or which books he written. So starting with the introduction on the page 3, dedication of all teachers, and also name of his gurus like Dr. Sunirmal Sarkar sir, Dr. L.M. Khan sir, Dr. S.M. Singh sir, Dr. M.M. Datta sir. He has paid gratitude to all his teachers. Then on page 4, the foreword is also beautifully written by Dr. Gajanan Dhanipkar sir. Then gratitude to our teacher and team who helped him to bring this copy before the fraternity on page number 5. Then page number 6 is about uh, Sarkar sir's forward to this book. Then Borkar sir's also there. Borkar sir writes, this is extremely informative book and Nosodes and Sarcodes, and I also agree that this is the complete book to have a sound knowledge about the Nosodes and Sarcodes with the modern day of understanding. So on page number 7 to 10 there is index about the book, what exactly actually it contains. So this book is actually divided in 7 sections. So first is introduction, second is Sarcodes, there are 22 drugs. Then third one is Nosodes, where 29 Nosodes plus 8 different strains of tuberculinum are discussed in details. Then the fourth section you will know about bowel nosodes. Actually, this was the topic which was difficult for me to understand before reading this book. So I got very much confident to use bowel nosodes in day-to-day practice after reading this book only. Then the next section will be of therapeutic index, and then clinical hints, and then potency table. So this book is divided totally in 7 sections. So about Sarcodes, in chapter 1 he talks about the list. He talks about what Sarcodes are, how they are prepared, their indication, and when to use them. So first Sarcode, he starts with adrenalinum. So in adrenalinum, he almost in many Sarcodes, he has mentioned the basic physiology, basic need of that Sarcode in our body. Sarcode is medicine, but adrenaline, what is the utility, what is the physiology or pathophysiology of adrenaline, when it gets excess or when it gets reduced, then what will be the effects on our body. So he starts always with that in many of the remedies, under many of the remedies. Then in all Sarcodes he mentions the main theme or genius, you can say. So that will be core of that patient. So as like in adrenalinum, there is state of burnout, and also the author has mentioned whatever the source book he has taken help of to write down those lines in his book. So he has referred like Pulford Matra Medical Clinical Science, then Boric, then Dr. Sarkar's keynote about adrenalinum, that is constriction of chest with hypertension. Then we also see many cases in our clinic which are coming with cholera or gastroenteritis status with dehydration. We think of arsenic, and then arsenic fails, then this is the nosode which can help. You can get on which indications you can prescribe adrenaline. The next sarcode comes in this line is cholesterinum. So we usually know the indication of cholesterinum in gallstones or gall colic, but you can see the other indications like vitreous opacity, where ophthalmologist will do vitrectomy, that is a surgery, but you can avoid this surgery with after using the right after using cholesterinum at the right time. Then in this cholesterinum, he also has mentioned the comments of Dr. Span, Dr. Burnett Ingling, and also Dr. Allen in cases of liver cancer. Then the next sarcode comes with cortisone. So same in cortisone, the normal physiology of cortisone in our body, then genius of it, and same is with the next drug ACTH. Then the next in the list comes is sixth sarcode is DNA. So apart from chromosomal diseases like Downs, he has given other routine clinical condition with full mental and physical picture of that sarcode DNA. Then next comes estrogen and folliculinum. So he has mentioned in both of these, we know the routine indications, but apart from routine indications and to support the routine prescription, what should be the totality, what should be the mind of the case, what should be the physical symptoms, they all are mentioned under these remedies. Then the next comes is ninth one is histaminum. So about histaminum, I have posted, I think before 1 year or something like that, the most remedy in Armat Remedica, which is the most remedy in Armat Remedica in some of the groups, and no one was reached to this remedy because I read this most remedy from this book only at that time. So you will get the peculiar modality under insomnium, that all fears are ameliorated in night, which is very peculiar. If you come across such a case, then you can think of this sarcode if other totality matches. Then he writes about insulinum, then uporinum indication in PCOD, PCOS, infertility. Then also added the oxytocin, the physiology and clinical condition of oxytocin, which is known as love hormone. Then special note of research on nasal oxytocin used in 2011 or 13-14. So I will request my readers to go through the research nasal oxygen reports, because they will uh, uh, they will uh, they will install a thinking within you to think out of the box whenever you are practicing or writing a book. Then the next thing here comes is parathormone, then pancreatinum. In pancreatinum, now sir has mentioned the use in gout apart from those pancreatic diseases. Then pepsinum, here he mentioned the Blackwood's writing. Then pituitarinum I am also using in cases of childhood children cases who are complaining of recurrent abdominal pain with wonderful results. But this book, after reading this book, whatever I learned, new indications are like head injury, stroke, then absorption of clots. We are giving sulfuric acid, arnica, but clots are remaining there, and if they are not getting resolved, or the clots within the brain, then this is the sarcode which can be used as intercurrent if the other totality matches. Then also indication of pituitarinum, uterine inertia, then postpartum hemorrhage, hernia and intestinal obstruction. So the common indications are told over here about the delayed development in children. Then he also mentioned clinical indications of Dr. S.C. Ghosh. Then the next come in the list is anterior pituitary, then posterior pituitary. In posterior pituitary 4-5 cases of coronary artery disease with angina of Dr. S.C. Ghosh were mentioned. Then next come in the list about progesterone, then RNA, then serotonin, then testosterone. So I will request to read all these from the book only. Then in testosterone, if you see the clinical indications like decreased testicle size, then decreased amount of semen. This was new to me. I have a one case, but I was not knowing at that time that testosterone as a sarcode can be used in between to the patient who are having less quantity of semen. Uh, then in indication of testosterone in cases of gynecomastia, which we usually see in pubertal age, and then about the indications in virilism. So then the next in the list comes the most commonly used and most what we can say that use with errors, the most use with errors, the sarcodic thyroidinum. So he starts the thyroidinum remedy with first line as a deeper acting remedy. So you must remember, we must have indication to prescribe thyroidinum. Then to know the genius of remedy, definitely you need to go through the book. Then he also mentioned two cases of Dr. A.C. Ghosh, and if you read those cases now, you will know the thought process of Dr. Ghosh sir behind prescribing thyroidinum. So you will really love to have you really love to read those cases. Then in cases of female getting convulsion at the end of coition, there is one case mentioned over there, and that ends this remedy with 8 rubrics of Phatak having thyroid in thyroid gland involvement. So it's really the beauty of this guru that he also given importance to the smaller repeaters read like Dr. Phatak. So the next section is about nosode. So I will declare the offer given by sir and his team, Dr. Srishti, who has really helped me out by talking with sir to have a good offer to my viewers. So I am thankful to both of them, Dr. Srishti Bhandari and Dr. Gaurang Gaikwad sir, for availing this huge discount to my viewers. So you will get 25 discount after using coupon code DRBAGAL. So that will be the code. You need to WhatsApp this code to the number I am sharing at the last of this video, or you can mail the coupon code along with the name of the book on the mail ID I will share in the last section of this video. So on you are getting 25% discount on the MRP of the book, and this discount you are getting on 3 books. That is, first is what is Mathematics of Nosodes and Sarcodes, then Decoding Mental Rubrics, and Homeopathic Maps and Strategies in Acute Condition. So you are going to get 25% discount on all of these 3 books if you are using this code. But you need to order it before the 15th of June 2024. So now again coming to the next section of this book, that is about nosodes. So in this section he mentions that Dr. Herring was first person to test animal poisons and nosodes. So he has started from the history, then came to classification nosode, which was very new to me, that basic, exanthemus, isopathic, autogenous and intestinal nosode. So indications to prescribe nosodes, I will like to ask my viewers to comment which was the first nosode proved by Herring on himself. You need to write down the name. This is homework for my viewers, and I will really like if many of you come to the right answer. So you can comment under the in comment box. And then who introduced the term nosode, he writes about that in homeopathy. Also I would like to know the name of the doctor or the legendary homeopath in past who introduced this term nosode in homeopathy. Then Herring's contribution to nosode and isodes. This is also a new term for me, isodes. I never heard of that. So I will like my viewers to purchase this book, or if they are knowing this terminology isodes, they can also comment about the what the term isodes means. So in nosodes, the first nosode is AIDS nosode. So rubric of mind section given under this will lead you to understand the detail core or detail mentality of that patient. Sorry. So we'll get the thorough dark picture of AIDS nosode under this. Then Bacillinum burnet. You will come to know why it is broad spectrum nosode, as Dr. Gaurang sir says, and more indicated than tuberculinum. So both tuberculinum and bacillinum are prepared from tubercular lung, but you will come to know the exact difference between both. What was the exact material to get prepared. Then he also writes about Shankaran sir's main feeling. Actually, it was proven by Shankaran sir also in his clinic. So hecticness is the main feeling you will come to know. Then role of bacillinum in mesenteric lymphadenopathy or TB of glands or TB of intestines. So many patients come with reports to us with mesenteric lymphadenopathy. So you can think of this nosode in such a cases, other than thinking of tuberculinum, if the totality agrees. So whole chapter is supported by rubrics. Then most important observation keynote about palms perspiration, then nails, then about teeth. So you can just confirm by looking at the patient whether to prescribe this nosode as intercurrent or not. And then this chapter ends with Dr. Sunilman Sarkar and Dr. B.N. Chakrabarti sir's comments. Then the next nosode comes in this list. Third one is carcinosin. So main theme of carcinosin is written over there. So common concomitant of carcinosin is sleeplessness. Total 11 pages are dedicated to this nosode, which covers Morrison's writing, Digby's lectures, class writing, P. Shankaran sir, R. Shankaran sir, Cooper's writing, Fobister's writing, 12 clinical cases by Fobister. Because Dr. Fobister was the person actually who bring this important nosode as a polyphrase before our fraternity. So you must go to all these 12 clinical cases by Dr. Fobister. After reading this from book, you will solve your stuck cases. I am assured about it, because I have experienced the same in my few cases also. Then the next nosode comes in this list is coroninum. So this nosode actually it was needed just after the corona. So it is indicated in many post-COVID symptoms, which is prepared in abroad. I don't know where it is available. I have just now ordered it. Then the comes in the list is episterinum, which is prepared from tumor of uterus. So in your fibroid cases, you can think of this. You must need to read all indications from this book. Then the comes in the list is enterococcinum, which is prepared from enteropicalis. And then the hypoxenium, stubborn nasal catheter cases with ulceration of nose cartilage. We are getting many cases in stubborn catheter, so we can think of hypoxenium as a nosode. Then there is influenzinum. He writes about genius of the remedy with cases by Dr. Tyler, Dr. P. Shankaran, Dr. Shankaran, and Stern's writing are must read in this chapter. Then the next in the list comes the leprominum. So leprominum was introduced by Dr. Vakil from data received from 100 cases. So you can remember that this nosode is actually verified in 100 cases after proving in India and in Mumbai by the well-known homeopath of old days, or he is also practicing right now, Dr. Vakil sir. Then the next nosode is lycinum. So indication to prescribe in future generation, what Dr. Gaurang sir writes over here, indication to prescribe in future generation without animal bite. Single drug rubric from near repertory mentions close remedy, which is Xanthium spinosum. So this is the beauty to communicate with the Matramedica drugs to the drug picture of nosodes. Then malandrinum is there. I love reading cases about burnet of total absence of front incisor teeth cured with this under malandrinum. You will also love it. Then the indications of malaria nosode. Many sources he has referred to write down this about this nosode. 4 cases discussed will let you understand indication of this nosode. So he has mentioned 4 cases. Then the comes in the list morbillinum, which is clinically indicated in recurrent abortion, then GBS, then reactivation of tuberculosis, autism, and also mentioned cases by Dr. Shepard and Dr. Clark. Then the list come medorinum. I cannot summarize it as Sir wrote 12 pages to this most important and neglected nosode. So 110 plus see in repertory, foodie, undisciplined, careless, that is the core. It is said, what Sir writes, it is said we live to eat, but Medorinum lives so that he can eat. So, all in all, he has mentioned about the appetite, the necessity to eat by the Medorinum people. You will also see the comments of Dr. Ken, Dr. Sarkar, Dr. Burnett, Dr. Banerjee, L.M. Datta Sir, Bogar Sir, Dr. Vijay Vaishnav, Dr. Shankaran Sir, Dr. Allen, Dr. Kent, Dr. Tyler, Dr. Swan, Dr. Hubbard, and Dr. Sutherland. So it was not an easy task to pen down one remedy, and to pen down one remedy, he has referred more than 12, 13 authors. So hats up to you, sir. Then the next remedy comes is osteoarthritic nosode. So it is prepared from synovial fluid or arthritic joint. Sir mentions about genius, then also he writes down over there clinical confirmatory symptom and potency with repetition wherever it is mentioned. Then next in the list comes the oscillococcinum, then pneumococcinum, then parotidinum, role of parotidinum or doses to prevent mumps, then pyrogenum, then soranum. Soranum, sir writes about 13 pages. Here also he has referred more than 50, quoted more than 15 authors. So you need to read this from book only. Then the comes Nosodes ringworm. So this remedy and miasm brought before our profession by Dr. Shankaran sir. Very peculiar dreams are there. So it is worth to read about the dreams of ringworm in this book only. Then comes streptococcinum, then staphylococcinum, then syrinum. So if you see the syrinum, this nosode is usually we know to be used in cases of breast cancer. So apart from its use in another cancer with keynote indication and surprisingly as intercurrent remedy or complementary to Sina and Tecurium in worms. So he has written very much beautifully. I would have never thought about this thing that in a child of Sina or Tecurium with worms, and we can think of nosode like syrinum as an intercurrent remedy. Next is syphilinum. Sir has given 17 pages to this. Then the tuberculinum. So you really need to go through this because he has for writing down one nosode he has referred more than 20 authors and quoted comments of more than 12, 15, 13, 12, 15, 20 authors under that nosode. So then comes tuberculinum. 21 pages are dedicated to this nosode. And what you will see now, you will come to know about the total 23 varieties of tuberculinum are there. And sir has mentioned some important tuberculinum which we use in our day-to-day practice with their indication and their short drug pictures. So then the then the next comes with tetanotoxinum. So apart from the what we think by reading the name it may be used in cases of tetanus or epilepsy, but you can use it in cases of multiple sclerosis and Parkinson. That is very new to me, that tetanotoxinum we can use if indication matches. And then the last nosode in the list is about variolinum. So single drug rubric of swollen testicles is also there, so you can go with this. Then we will come to the next part of this book, which is about bowel nosode. So this was actually a difficult topic for me to get, understand and use bowel nosodes on which indication. There are very less data available and there was very big confusion within me, what was Gartner, what was Patterson. So it was very confusing to me, but everything gone away after reading this book. So in introduction of bowel nosode, he write down about evolution of bowel nosode, who invented it, who then taken the work further, and then who again taken that work to the to extend, means newly additions. So it was actually evaluated by Dr. Back. Frankly speaking, you will need to learn bowel nosodes only from this book. Previously, I have read two books, but I cannot understand, so I was not able to finish those two books. Sorry, two. I got one book. I was not able to understand anything from that book, so just I left reading the book after 20 or 25 pages. So in this list, you have Morgan Pure, then Morgan Gartner. I was actually having confusion between these two before this book. Then the comes to Proteus, and then psychotic compound, then Bacillus Gartner and Bacillus number 7. All these 7 bowel nosodes are mentioned over there. So what he has done now, he has write down the genus of all bowel nosodes, indications of them, rubrics of all bowel nosodes, then comparison of these bowel nosodes with constitutional remedy. For example, he has compared Morgan Pure in relation to sulfur and Morgan Gartner in relation to lycopodium. So if our case of sulfur is stuck, or our case of lycopodium is stuck, which are constitutional remedies, they are stop responding. If you introduce this bowel nosode, then it may remove that block and your case may get solved, followed by the your constitutional remedy. So under each and every bowel nosode, he has mentioned about the relation of that bowel nosode with the constitutional remedy in our mater medica. Then the part 5th is about the important rubrics, therapeutic index of sarcodes and nosodes. So before moving to this part, I am going to announce the offer given by Dr. Gaurang Gaikwad sir, which is helped to bring before you by Dr. Srishti, who is assistant to sir. So in month of June, sir is going to start a course on rediscovering repertory starting from June 24. So you will get 30% discount, and you need to use the code DRBAGAL, that is Dr. Bagal. You need to WhatsApp or you need to mail this code and your participation, what discount you will get. So discount you will get 30% on the course, but this discount on this course is valid only if you enroll and complete your payment before the 30th May 2024. So I will share the WhatsApp number and mail ID on which you are going to request for such a discount. So what I will just mention what this course is all about. So it will have 20 sessions. It is total of 30 hours training. Then the course will run on every Friday between 8 to 9:30 p.m. Indian Standard Time. Online it will be the total online course, and there are many eminent speakers will talk about this topic. Like Dr. Mayuresh Mahajan sir, Dr. Prasad Rasra sir, Dr. Luke Norland, Dr. Krishna Kumar Dinde sir, Dr. Manish Yadav, Dr. Shirish Paranspe sir, and many more. So you will learn from what you will learn in this course. So you will learn from basic to advanced repertorization, then conversion of patient language to rubrics, when to use which repertory, then clinical use of Kent, Nair, Patak, BPCR, BTPP and Murphy's repertory, and many more things in this course. So I will share the details how to join this course in to where to ask about discount to join this course. So I will assure you that on the book and on the course also you may not get this type of discount anywhere other than here, most probably. So I will request, if you want to purchase the book or if you want to join the course, so please watch this video and use the coupon codes appropriately. So coming to the next part of this, which is the important part of this book. So in this part, important rubrics and therapeutic index of sarcodes and nosodes, if you see, you will see that this part is arranged as like Katak repertory, that is alphabetically. So there is subsection which is first is general, then the clinical. So general is arranged alphabetically starting from abdomen, external, pendulous, enlarged. So this is the index rubric, you can say. And the remedies which will cover this rubric. So remedies written are Cipilinum, Tuberculinum, Variolinum. So Nosodes and Sarcodes both are written under such a rubrics whenever they are indicated. And this general arranged alphabetically index ends with the yawning, paying attention to others' pain, and lysine is the remedy. So it's like a repertorial index, so you can get a quick reference. You don't need to search the whole mater medica while you are referring the book. While you are dealing with a case, if you want to refer, you may not remember where do I read in Sarcodes nosode or bowel nosode. So you just keep that thing in mind. You just go to the index at the last section. You see the word or the observation over there or clinical condition, and you can just go to that 2, 3, 1, whatever nosode and sarcodes are listed over there, and you can reach to the right remedy within short time. And next section of this is clinical. It starts from agranulocytosis. Corticotropin is the remedy over there, and ends with tuberculosis. So this subsection mentions about the name of the clinical diseases. Right. So most important topic about uses after this. In this book he mentions about most important topic about uses, then dosage, then indications of different sarcodes on page number 245. I will advise my readers not readers, I will advise my viewers to buy this book if they don't have the copy, because this book is a complete package which holds your hand and take you to the path of recovery, the path of recovery along with your patient. Because what happens now, we may get the knowledge about the drug elsewhere, but we may not get which potency and how we should repeat in those cases. So this is the book which is actually the complete package. So I was talking about the uses, doses and indication of different sarcodes on page number 245. So for example, he writes pituitary gland 30 CBD for 3 days for developmental delay. So this is simple. You have a case of developmental delay, you have prescribed your constitutional remedy, patient is improved but the case is stuck. You need to give pituitary gland. You read this from book. Then what dosage should be given and how you should repeat. So it is also mentioned over there. This is one indication, but he has written all those indications of different sarcodes on page number 245. Then same he mentions about the bowel nosodes on next pages. Then about potency, repetition and clinical uses of nosodes from page 246 to 248. So here divided sarcodes differently, nosode differently, bowel nosode differently. Then he also we'll take one example on nosode. For example, E. coli 30C in cases of UTI. So, and then next he writes, if it fails, next possible follow on remedies are given. So he is totally guiding you. Your stuck case of sulfur of UTI, recurrent UTI. You have given her that patient E. coli as intercurrent. You don't need to stop over there. You need to either go with sulfur. In some of the cases, if you read over there, in some of the cases he writes followed by constitutional remedy. But here he writes next possible follow-on remedies are given, and after that he has mentioned a line. I will ask you to read that line, which are the remedies or the set of remedies he mentions over there. So it's a very classical point in this book. Then page 249 about clinical comparison between bacillinum and tuberculinum. Then page 250 about potency table in general, which is the most common क्या बोलते हैं ना उसको कि मोस्ट कॉमन क्वेरी फॉर द बिगिनर्स और द न्यू होम्योपैथ्स कि मदर टिंक्चर, वेयर टू यूज मदर टिंक्चर, हाउ टू रिपीट लोअर potencies, how to go with higher potency. It's apart from Nosodes and Sarcodes. He has indicated over here about the general idea. So it is a really wonderful for beginners or the practitioners. Then page 252 of this book lists books written by Dr. Gaurang Gaikwad sir. Then from page 253 to 255 about various online courses and workshop by author, and also they are available on the website drgaurangaikwad.com. So it is spelled as drgaurangaikwad.com. So then page 256 and 257 about the homeopathic hub and consultation details of sir. And on the last page of this book he writes about the contact details of himself. So all in all, it is more than 35-36 minutes I have reviewed, but this was the really needed detailed review of the book. Previously this book was reviewed by my virtual guru Dr. Anandair from Pune, and he has also mentioned the utility and the necessity of this book 3 years back. But this is the detailed review. I am not the I am very small person who will comment on the lackings in this book, but review should be the genuine. So this book can be more beneficial if it was supported by many cases or 2 or 3 cases under each remedy with indication by Dr. Gaurang Gaikwad sir. So I feel that is lacking over here. So he can improve in next upcoming books whatever he is going to write, because what happens now, whatever experience sir the peoples like sir have now, it helps us a lot, because instead of writing cases of 12 cases by Professor on carcinosin, it was definitely good, but it would be more beneficial for peoples like us if some of the cases were cut short and some of the cases added by Dr. Gaurang Gaikwad sir. So this was the only lacking thing I think about this book. What is my expectation from the author as a student of homeopathy and as a student of him also virtual student, that there is one topic which is about miasms and which is about the theory of chronic diseases. So I will really love to see the book in upcoming time by sir also. I will advise my viewers to at least go through this book at least for 2 times. You need to read this book at least 2 times, then you can remember something. Please have it handy in your clinic. Whenever your stuck cases are there, you just go to the therapeutic index and you just read that nosode or sarcode. So if you get to use them, then you are getting the good idea about that nosode or sarcode. So lastly, I need to share to you the mail ID and WhatsApp number where to order the book or where to order the course. So you are getting discount of 25% on the books which I already mentioned. With 3 books you are getting 25% discount and 30% discount on the upcoming course. So you need to contact on WhatsApp number, that is 9867584902, or you can email on gauranghg@gmail.com. So you can I will spell the mail ID GAURANGHG@gmail.com. So thank you all. Please do watch my videos on my more videos on my channel which are about Phatak repertory, and I will really love if you share this channel, and your comments are always welcome. I already asked 2 to 3 queries in this video. I will like my viewers if they comment the right answer in the comment box. Your suggestions are always welcome. Whatever you suggest me to, which books you want to get reviewed by me. So thank you all, and once again Keep inspiring, keep reading. Hail Hanuman, hail homeopathy. Thank you.